Thanks for joining us on Tandem Radio for a very special segment, By Design, focused on helping you understand how God designed you so that you may be healthy and productive in fulfilling God's purposes in your life for many years to come. Now let's join our host, health expert and public speaker, Dr. James Proodian.
Welcome to the By Design radio program. My name is Dr. James Proodian of Proodian Healthcare and ProodianHealthcare.com, where health literacy is the key to longevity. And as long as God has us on this side of eternity, my show is designed to educate you and your families to feel better, to function better, and live as many quality disease-free years as possible. Knowing that trauma and tragedy is out there, those are the things we cannot avoid. The show is really designed to equip you with the things we can incorporate into our personal lives to make slow changes but have big results. So we're starting this week off with the Bible verse, Luke 1:37. For with God, nothing is impossible. And that Bible verse is the backdrop and the theme to my shows, because I want to encourage the audiences and the people listening to me that no matter where you are in the spectrum of health, from very sick to feeling pretty well, there's always ways in which God is revealing science to tell us better ways to feel better, function better, and live longer through the physical, nutritional, and psychological properties He's blessed us with. So from a physical perspective, we look at our physical body. From our nutritional perspective, it's the biochemical properties of the food we put into ourselves. And psychologically, that's how we process information, emotion, and our mental state, the noodle between years. So those three components coming together make up the backdrop or the science or education behind the show. And starting in weeks 1 and 2, I gave you guys an overview of what By Design was all about. And then we got into weeks 3 through 5. I did my first foundational series. And what By Design is going to do, it's going to build foundational building blocks. So weeks 3 through 5 were about detoxification. That's a foundational understanding. This show is cumulative, so you always want to go back. If you haven't checked out those shows, go back to Tandem Radio and you can see the archive shows. Then weeks 6 through 7, we did epigenetics, which was another building block. That was more foundational. So the two foundational topics we've done, detoxification and epigenetics, and I'll get to the third one another show. I decided today we're going to speak more topically. From time to time, I'm going to take a break from the building blocks and speak more topically. Today's topic is the stark difference between sick care and health care. And we're going to walk out of here today. You guys are going to go about your business with hopefully a better understanding that we live in a sick care system, not a health care system. So let's be literal. Let's get the boots on the ground, and let's start by defining the very definition of health. I learned health as a pre-med student. I was a public health major. I did a bunch of things in undergraduate school, but I remember learning this amazing definition of health. It's a complete state of physical, emotional, social, mental, and spiritual well-being, and not merely the absence of disease or infirmity. And what that meant to us, or it should mean to you, is we're a complete body. We're whole from the way we're physical, the way our brain, from an emotional and social perspective and spiritual perspective, and they all tie in, not merely the absence of disease or infirmity. It means that many times we hear, I feel good, therefore I must be okay. Not necessarily so, because if anybody out there has ever had a loved one or a friend who's developed cancer, you realize that one of the last symptoms to show up in cancer is pain. So we don't wait for symptoms to show up. Yet our healthcare system works many times, most of the time, like what's called a sick care system. We wait to get sick, we go to the doctor. Now, there's nothing wrong with that, but let's take a personal accountability. Let's take personal responsibility for our own health by better understanding and not getting upset at our doctors when you feel as though they don't treat you the way you should be treated. Doctors go to school, right? And think about your medical doctors. They're equipped really for acute care, meaning there's an episode, something happens to you. You break your arm, someone has a heart attack, call 911. These are things, thank God we live in a system of emergency and traumatic care that's the best in the world. Yet the United States is ranked somewhere around 27th, 28th in the world in healthcare. So we have to be very, very conscious of the fact that there's sick care and there is health care. Really, when we get sick, we should go to a doctor. We should find out what the diagnosis is. But if the doctor gives us a very simple, single-dimensional approach to getting well, like take this medication, understand that you're most of the time interfacing with someone who's trained as a technician to diagnose and to treat medically. And not that there's anything wrong with that. I just want to open the knowledge and the understanding of what our system is today and the fact that sick care is bankrupting America. That's not me. That's, New England Journal of Medicine and statistics. The fact that we're looking at a system that's fundamentally broken. And when you look at the cost of healthcare in our country, the fact that 95% of healthcare costs are spent on disease management, while only 5% are spent on wellness and preventative measures. So the costs associated to going to our doctors when we're sick, 95% is spent on disease management, and 16% of our GDP is healthcare. It's going to 20%. Well, why is that? Well, chronic illness and the epidemics of chronic illness like type 2 diabetes and obesity and high blood pressure and heart disease, these are the costs associated with disease management. We call that sick care. Now, health care, again, we're going to get to that in a second, but that's optimizing our health. That's using our physical, our nutritional, and psychological every day to be building better bodies, stronger bodies, better minds, better connections with God, because God designed us to live an optimal life. We're here, and we want to use our God-given food, our God-given ability to reduce stress, and our God-given ability to do exercise for our physical body, and so that we don't fall into sick care. Listen, I thank God it's there, but I really prefer not to be part of the sick care model. So the imbalances that need to change in order to drive significant lifestyle changes require your participation. Someone's not going to give this to you. It's personal responsibility and accountability through education, and one's lifestyle will dictate the outcome of disease or the outcome of chronic disease. So chronic disease, anxiety, depression, cardiovascular disease, type 2 diabetes, things that contribute like smoking or obesity, these lifestyle behaviors impact our health and also our productivity. So the line I'm drawing in the sand today is that of sick care versus health care. The cost is staggering. It's absolutely staggering. Whether you're for or against the new healthcare laws that are coming out of Washington, I'm not, whether you're for or against it, we all have to sit back, no matter who you are, and accept the fact that we're not doing a very good job taking care of ourselves. We're not doing a very good job understanding God's law, as sick care has bankrupted America. And I wish it hadn't. I wish the cost of healthcare wasn't so high, but it's the utilization of the system by very sick people that is driving up the cost of healthcare. So, and they're going to turn this around because there's things we're going to do about this. And focusing on behavior, focusing on personal responsibility, so that we do not allow our genes to express disease and syndromes. We're going to try to turn those genes off. Go back to episodes number 5 and 6 when we did epigenetics. Those were one of the foundational building blocks. You really need to understand what genetic expression is all about, so that when we look at the fact that we've got a chronic disease epidemic in our country, let's stop blaming our doctor and start understanding that their training was done in such a manner to really focus on sick individuals. But I'm going to turn it around, and I know in past shows I brought up to you functional medicine. And anybody who wants to check out functional medicine, I can't advocate it enough. It's functionalmedicine.org. That's www.functionalmedicine.org. And I just want to read to you, and you can make your own decisions. Does this sound like a good game plan? Functional medicine is an evolution in practice of medicine that better addresses healthcare needs of the 21st century by shifting the traditional disease-centric focus of medical practice to a more patient-centric approach. Functional medicine addresses the whole person, not just an isolated set of symptoms. Functional medicine practitioners spend their time with their patients, listening to their histories, and looking at the interactions among genetic, environmental, and lifestyle factors that can influence long-term health and complex chronic disease. In this way, functional medicine supports the unique expression of health and vitality for each individual. I look at that, and that's not me, I'm taking that directly off of the functional medicine website. The Institute of Functional Medicine was designed by Dr. Jeff Bland, who I've spoken about in previous shows. And maybe you want to spend some time this week looking at sick care and understanding that we've got an amazing medical system there to tend for us during emergency and trauma and when we're sick. But we need to start focusing our time and our energy and taking better care of ourselves through personal responsibility. And that begins with finding practitioners who are like-minded to the definition I just read you. You could find those practitioners at Functional Medicine. I always get that confused. It's .org, functionalmedicine.org, as lists of practitioners throughout the country that practice this way. And I would really advocate you taking those steps and becoming better educated through certain doctors and the way doctors practice. Listen, I thank God for cardiologists. I watched a cardiovascular surgeon save my father's life over 30 years ago due to a heart attack. They serve an amazing purpose, but I want you guys to really take away that the techniques used in sick care are many times different than the definition of healthcare. And looking at healthcare as a multi-dimensional component from a physical, nutritional, and psychological perspective, also looking at the genetic expression and the environmental toxins that we come in contact with, create a holism based upon science, not based upon something that I think or that I made up or somebody else made up, but is validated through research. And that's what, at the end of the day, we can't make suggestions unless it's been somewhat proven. So thank you for listening to the By Design radio program, and thank you for joining me this week. If you'd like more information on me and Proodian Healthcare, please go to ProodianHealthcare.com. It's spelled Proodian, healthcare.com, and feel free to submit any questions you have for me at the show. I'll try to get to them in upcoming weeks. And be well this week. God bless you, and let's get out there and move.
You've been listening to By Design with Dr. James Proodian of Proodian Healthcare. To learn more, visit us at tandemradio.com, that's tandemradio.com, or on Facebook. And don't forget to email us with your questions. We'd love to hear from you. In the meantime, hope you have a healthy week, and we look forward to you joining us next time for more fantastic insights from Dr. James Proodian on By Design, a special production of Tandem Radio.